Okay, so I'm now 10 days post my meniscus debridement and my knee's settling down really well. I've got very little pain in my knee now, it's moving quite well. I'm still wearing some compression during the day, especially when I'm up and about, just to try and keep the swelling at a minimum. I still have the dressings intact. Usually about that 10 days, 2 week mark, you should be seeing the doctor and remove the dressings, but keep them intact as long as you can so that your wound has got no chance of getting infected or any dirt and grime and moisture getting in there. Exercise-wise, this is a stage where you can progress on to doing a little bit more weight-bearing type drills, provided you have only had a minor debridement. If you're an older person over the age of around 45, 50, you need to be in touch with your physio and definitely in touch with your doctor about how hard to push your knee, because in the first 6 weeks it's really important to go nice and gentle. There's a thing called post-arthroscopy syndrome where your knee will be swollen and sore, and sometimes the subchondral surface, so the bony surface of your femur or your tibia can break down a little bit if you push it too hard at this stage. But if all's going well, use pain and swelling as your guide and gradually increase your activities. It definitely depends exactly what the surgeon does in your surgery to how quickly you progress along, so do check that with your surgeon and your physio, and you usually have this sort of review point with the physio and with your surgeon around that 10 days, 2 week mark. So as well as the exercises on the bed that you can still keep doing, you can still keep using the ice for 20 minutes, but you probably don't need it as much as every 2 hours now. You might be doing it 3 or 4 times a day. With your walking pattern, I'll try to get a little bit of a space here so that you can walk. Try to be as smooth as you can, making sure you extend the knee fully. Your knee should get to full extension right in the point of that mid stance, and you should be walking nice and smoothly with no real pain. The other exercises that you can start are some very small squats. Now, deep squats are never encouraged in this early period of recovery, but you can do that top third of your squat, nice and smooth, thinking about locking your legs right into full extension, not hyperextending, nice and easy as you go through that side on. So getting your bottom back, keeping the weight on your heels, and nice and smooth full knee extension. You can move this into also a split squat, where your stance is a little bit broader, weight on the front leg through that heel, and trying to straighten up into full extension. You should feel your glutes come on as you do this, and it should be a nice, slow, steady exercise. You can definitely do it both ways, with both feet having a turn in front, and it's nice and slow. The number of these you might do would be 20 to 30, but it does depend on how your pain is, and you don't want to go deep. You can definitely start some one-leg balance type drills, so thinking about what's happening in your trunk and pelvis, and trying very small bends in there. This is not a strength exercise, it's just working on that knee control. Can you control your hips and pelvis? And same thing, side on. Are you getting that knee nice and straight as you do your control? You're not going to do a lot of those one-legged drills, but it's nice to do a little bit on one leg just to get a little bit of balance going. Gradually increase your walking, as I said. You can probably get on a stationary bike at this stage as well, and gradually progress your sort of cardiovascular endurance as well.